I think it's important for everyone to understand that not so long in this country, doctors were recommending cigarettes for your teeth, for anxiety, for a number of just totally made up health effects that, of course, they did. Why? Pretty much for the pure sake of profit. But today, if you question that same medical industry, you are put to Facebook jail, you are demonetized, you are censored, you are downranked in the algorithm, or sometimes you're completely deleted from social media. So that's why in this video, we're going to continue to question the medical industry and this latest new FDA approved medical device that literally sends an electric pulse through children to deal with supposed ADHD, which, of course, there's a big debate going on if ADHD even exists. But I tell you what does exist. The sugar industry buying off and paying off scientists to point blame on, of course, the fat industry, while, of course, American consumption of sugar has gone up 30%. And with that happening, with children getting more and more sugar than they ever had before. No. You can't have a conversation about diet, And then whatever your thoughts are about ADHD, I know Jason Berman says very strong. We're going to get into that a little bit. I could definitely say that it is being overdiagnosed and overtreated, even according to a Harvard Health publication officially coming out in a report dealing with these statistics. Now, Jason, it's interesting with people begging the FDA to pass some kind of regulations, to pass some kind of rules and laws with a natural plant and CBD. CBD that has proven to help so many other individuals. Still, they drag their feet on that. But now they passed this new electrical pulse device that literally is put on children's heads when they sleep. Children as young as 7 to 12. What the malarkey is happening here, Jason?
Well, we're going to watch the video, but I want to give a little synopsis before, because the way that the video is presented makes me almost as irate as I am right now. First of all, let's get to ADHD, okay? Attention Deficit Disorder, okay? He's hyper. He doesn't know what to do. It's not even just ADD. It's added on to that. And all I know is that I was a very hyper child. I didn't need drugs. It was called parenting. Not everybody. Well, first of all, when you're a kid, you have a lot of energy. And you may not sit down and pay attention, especially things that are not captivating to you. And listen, you don't have to listen to me. I'm not the end-all, be-all. But again, when you have basically mainline science still debating whether it's a thing, and I got to tell you, I don't think putting your child on Ritalin and changing their brain chemistry is a good idea. When I saw this, again, look at all these. Is it real? Is it not real? Let's keep debating. There's plenty of people on both sides of the fence. And like Luke said, we know that doctors can't always be trusted. We know that the medical industry can't always be trusted. Remember when they were just spraying children with DMT? You remember that? That happened. That's not that long ago. So this device takes an electroshock on their brain, where their brain is still developing, and for 8 hours in the evening, let me repeat that. For 8 hours in the evening, it sends an electric pulse throughout their brain. And we're going to play the clip, but I want you to notice how so much authority is given to the pretty women that are promoting this, the mother figures, the woman you'd like to date, the anchor's a little older. They don't challenge anything. And finally, the dopey guy steps in. We'll get to it. And he's like, well, I don't know if I want to fry a kid's brain. And they're like, oh, boy. And then we're going to get to what the actual study was done to get this approved by the FDA. I wonder if the wheels were greased. Let's just play it.
In today's morning rounds, the FDA just approved the first device to treat attention deficit hyperactivity disorder, or ADHD. We first told you yesterday about the breakthrough that will be marketed as a treatment for children who are 7 to 12 years old.
Let me stop that. The breakthrough. This is a breakthrough, Luke. Go ahead.
And this is going to treat ADHD. Wait, hold on. There's still a debate if that's even a real thing. How is it going to treat when everybody's different? Again, this just came out. Does it work 100%? That's what you're alluding to, as of course CBS, a news organization, which most likely is financed by a lot of the big pharma companies. You look at the mainstream media, you see pharma advertisements everywhere. Why? Because they get finance. You don't bite the hand that feeds you. You enable that hand. You pet that hand. You suckle that hand, which CBS is doing here.
And speaking of suckling, did you notice the succulent falling of pills in the beginning of the segment? Like the sexy pill drop? Probably didn't even realize that. They have so many subliminals in these segments. Literally, as it came on and there was some easy music and they're going to tell you something, it's like a pill drop. Oh.
Now, in a clinical trial, kids got low-level electrical pulses while they slept.
Oh.
The results were similar to the effect of non-stimulant drug treatment.
Let me stop you. Similar. So it doesn't always work. They said to drug treatment, while they show you a graph of where children 7 to 12 had electricity running through their brain and pulsing from each side. This is incredible to me. This is like nightmarish Nazi stuff.
Estimated 6.1 million children have been diagnosed with ADHD in the U.S., according to a national survey of children's health in 2016. Our Dr. Tara Narula is here. Good morning.
Good morning, Nora.
She's a doctor. Look at her. She's pretty. She's smart. She has no apprehensions whatsoever about shocking your child's brain. Please go on.
The device.
Yeah, but hold on. Wait, right before you get in there, again, 6.1 million children diagnosed with something which people, again, a lot of strong people believe doesn't exist. Again, Harvard Health Journal released saying HDD, overdiagnosed, overtreated, no conversation with that at all. This is huge. Let's keep it going from here.
Treatment that's non-drug related, which is great for a lot of parents who don't want to put their kids on medication. And so it's the size of a cell phone, and basically it has a wire that attaches to a patch that's placed on the child's forehead. They wear it at night while they're sleeping for about 8 hours. It's meant for kids who are over the age of 7, not on medication. And essentially the way that it works is it emits a low-level electrical pulse that essentially stimulates a cranial nerve called the trigeminal nerve. And the idea is that that nerve then sends signals into the brain, particularly to the areas that are important for attention, for functioning and behavior. And the idea
Functioning and behavior, Luke. You know when they were doing these functioning and behavior with electricity back in the day? Oh yeah, that's right. It was the MK Ultra programs.
Yeah. And look, Jason, look what she said. Look what she said in the beginning. Oh, you don't want to, medicate your child with psychotropic drugs that have been found to have psychological illnesses and psychological problems for you. Just electrocute them, pretty much what she's saying. But let's talk about the MK Ultra thing a little bit more. I don't know if you want to get into that or you want to play the clip.
No, I want to continue. Just so people know, a lot of people are fooled into believing that this was just like LSD experiments. And I've gone over extensively how that is not the case, how this had amphetamines in it, mescaline subsidies, that the CIA actually went down to Mexico prior to the LSD and harnessed psilocybin mushrooms. This is what our intelligence community was into. That combined with hypnosis and electroshock therapy, including, by the way, actually putting electrodes surgically in people's brains. This is the type of stuff they were doing to control someone's mind or literally brainwash them. And they didn't tell them what the therapeutic effects were going to be. Now, some of this because this was happening in hospitals, it was also becoming somewhat mainline. And if you remember the movie One Flew Over the Cuckoo's Nest, Luke, Jack Nicholson, the main character, really enjoyable movie, really tough at the end, I'm not going to lie. Danny DeVito's in it, but at the end, there's a very graphic scene of him being electroshocked. And this, to me, is a very marginalized version of this, but we're doing it to perfectly healthy children, developing brains. So we're going to continue with this video. And, thank God somebody eventually speaks up. But this woman goes on a tirade for how great it is for some time. Continue.
The idea is that it can help symptoms. And they did see in this small study of about 60 kids over 4 weeks, it did reduce symptoms. It seems to be on par with the effects seen with non-stimulant medications.
So this is the area of the brain that's still developing, right? This is the executive function area of the brain.
Right.
Doesn't get fully cooked until about age 25. So what's the downside of? It feels like you're tinkering with a part of the brain that's developing.
Well, no kidding. No kidding. You should have been very angry. You should have been like, "What are you talking about?" Instead, he's like, "You know what? That seems like you might be tinkering with something. Like, so non-aggressive. Where are the outraged people? I'm having trouble holding it together talking to you about it, Luke. Off air, I was not so nice.
No, you're like, and then the guy here's like, the brains aren't cooked yet until the age of 25. No. They haven't finished developing. And when you're messing with kids, especially in that frontal lobe, especially in that particular part when they're still raising, the consequences could be very detrimental later down the line. And of course, this is most likely going to have long-term effects that we still do not know about. And we have to be very critical of Big Pharma, since again, time and time again, they've been so readily available to just buy off the mainstream media to just do their bidding. This has been happening for such a long time, and it needs to be called out. It needs to be criticized, especially when they're doing this. And happy you brought this story to my attention, Jason. Should we play more of that video, or do you have anything else?
Let's just continue through the clip, because it's ridiculous. He's actually questioning her, and she's going to sue them now. Well, again, there is no long-term study. How do we know how this is going to affect them down the line? This is a small group of very young children whose brains aren't developed, and you are shocking them. But tell us how great it is.
Clearly the first of its kind, and I think probably we have a long way to go in terms of the research. But as far as this study, they did not see any serious adverse events. They did see side effects like drowsiness, increased appetite, some fatigue, headache, teeth clenching.
Think about what she just said. I mean, my God. Headaches, sleeping more, okay, clenching your teeth. Of course, you're shocking the brain. You're shocking their brain. How are they supposed to react? This is insanity on the highest level to me. Now I am getting worked up. But tell us again how great it is. Increased appetite. I love how they threw that in there. I'm worn out that you're shocking my brain 8 hours a night.
But as I said, it was
FDA
a small
approved,
study, and it was over a short period of time. And we don't know what it would be like if kids were on medication when they use this.
How do you know the difference between a child that's a little rambunctious, a little distracted, a little hyper, and somebody that has ADHD?
I think there's a lot of confusion about what exactly this is. So
I've seen some kids, you go, I think they got some issues there. They go, no, that's just their personality.
Right.
You're not talking about Grace, Henry, and Riley.
Right. I was going to say.
A lot
Absolutely not.
A lot of the symptoms like daydreaming or fidgeting or really talking a lot could be
Daydreaming, fidgeting, or talking a lot could be misdiagnosed. Weird.
misconstrued. But really, this is a chronic disorder, affects about 10% of children, and it's characterized by three things: hyperactivity, impulsivity, and inattention. And the important thing is that it's pervasive. So you see it at school and at home. It persists for longer than 6 months.
And they can't control it?
And it affects function. That's really, if their function is limited academically, socially, emotionally, that's when you might, want your child to be seen and evaluated, and they may in fact have this.
So there were no awkward kids when I grew up, apparently. There were no kids that didn't want to pay attention or were a little hyper. I mean, I fit the category for a lot of that. And I made my way through without any medication, and thank God nobody's shocking my brain. I really don't have much more to say about this other than it should be outraged that this is FDA approved. If you don't think the game is rigged in the medical industry, just look at this. A study on 60 kids. It's not like it worked 100% of the time. These kids were getting headaches. They had fatigue. They were clenching their teeth. And they're being shocked 8 hours a night, 7 to 12 years old. I mean, what else do you say, Luke?
Yeah, FDA, thumbs up. CBD. No, we're going to drag our feet on that one. Many people, of course, reporting minimal to none side effects. Again, just many people. Again, the cannabis industry is begging the FDA for some action on CBD. And of course, they're not getting much on it. Obviously, just shows you how Big Pharma has a whole huge control grasp on not only the FDA, but also, of course, the media establishment, where most likely this doctor was paid up the wazoo by the Big Pharma industry. And they also are getting more control of social media, where now being critical of Big Pharma leads you to, of course, again, Facebook jail, demonetized, getting banned, getting censored, or just getting completely deleted. So this is why we're still doing this video, because it's an important video. It's an important video for everyone to talk about. That's why we need you guys to share it. But we also need you guys to sign up on our email list on wearechange.org on the right-hand top corner. Sign sign up on our email list. All your support, all you guys paying attention, your eyes and ears mean the most to us. If it wasn't for you, we wouldn't be here. And that's why I love you guys. Stay tuned for more here on wearechange.org.